Thank you, Daniel. Welcome, everyone. Probably to start with, I would say that I actually love my job, and who wouldn't? Information and Knowledge Management Branch. I've worked in government around data and information and use in decision-making for over 20 years, and what I can say is that this is a very exciting time to be part of what's happening across government and more broadly across the community. So, amongst other things, I am responsible for the health data warehouse, and following Simon's lead earlier today, also working with him and Craig, who we'll hear from shortly, around developing Data Lake based on our new Hadoop capability. And apparently I'm also going to be responsible for something called a waterfall, so I don't know what that is yet. Maybe that's something we can discuss in the Q&A. So, the Health Data Warehouse was established in 2012 to support the National Health Reform initiatives. It is a very significant investment in data infrastructure for the health portfolio. We have already established a number of advantages from use of the data warehouse. It holds a significant data holding. We heard about the importance of the medical benefits and the pharmaceutical benefits data sets. These really are a national treasure. We have over 20 years of these data, 40 years in the case of the PBS, held within the enterprise data warehouse. There are millions of records loaded on a daily basis, not just loaded, but quality assured, validated, and then organised and actually made available for use across the department. Almost 30 terabytes of data is held in the EDW currently, and there are over 100,000 files that we process on an annual basis. So just to give you a bit of a feel for the scale of the data and the asset that's represented by the Health Warehouse, not just the infrastructure, but also the data holdings. And it's really important, and this is reflected in some of the initiatives that we've heard about already today, that we actually make the most of that very valuable asset. And so that's really our mission, and where we're working with others to try and ensure that we achieve that across the portfolio. You can see from the slide that the majority of the data held within the EDW is actually sourced externally. We have working arrangements across government, in particular with Department of Human Services and Department of Social Services, that are actually providing a lot of the data that is actually used within the EDW. We also have arrangements with the Institute of Health and Welfare, and I'll be touching a little bit more on that arrangement and how we're actually working even more closely with them to leverage our data and infrastructure assets. And we also receive data from state governments and hospitals as well. So this slide actually shows the Health Data Warehouse at the centre of all of that, but it's really just part of our data ecosystem. And I think it's important to recognise that as well. So we've heard already today about the need for collaboration, the need for sharing data and information, even sharing capability so that we can actually unlock the value of that information. And that's already occurring. So already the EDW is part of a broader data ecosystem that is being used for analysis, research and other purposes. So it was established in 2012 and we are almost at the end of an upgrade program. By the middle of next year, we will have completed that. It's been underway for a couple of years now. And what that will do is that will actually make the latest versions of the tools, infrastructure and capability available to actually support some of the newer ways of working that we've heard about. So we've already heard about the importance of self-service and the emergence of that in actually opening up and providing access to data for policy research and analysis purposes. And some of these capabilities that we're putting in place are really an essential part of that. That's not all we're doing. So while I'm going to talk a lot about the Health Enterprise Data Warehouse, it's important to recognise that we're continuing to evolve and add to that. So we've heard about big data capability, machine learning, artificial intelligence. new improved analytic methods, and as part of our broader data environment, we actually need to be constantly scanning, looking for opportunities for how we're actually going to support and meet those needs, in addition to continuing to leverage the infrastructure that we've already got in place. So that's very much part of our strategy, and some of the earlier speakers touched on that as well. How do we actually ensure that we have a safe, managed, secure environment for our data, but also start to connect that up and make that accessible and really get the value from those data holdings. So one of the reasons why it's an exciting time to be working with data and information in government is because of the Data Integration Partnership for Australia. We are working with other government agencies, including PM&C, who are coordinating the work, and the ABS, AIHW and others, on the Data Integration Partnership. And that is actually being used to further develop and leverage that investment that's already been made in health data. And in particular, it's looking to not just look at making sure that we've got a safe environment internally, but making sure that when we're looking to connect health data externally, that actually that's being done in safe, secure ways. That the very significant data assets that are already held are actually being organised and quality assured and validated and actually made available for linking. So some of the policy insights that the government is expecting to get from data that's available at the moment will actually come through the linking work that's being done as part of the Data Integration Partnership. And so we need to ensure that our data sets are actually in a state to be able to support that. And then, of course, making those data and assets available more broadly as well. So an example of how we're doing that is we're already partnering with the Australian Institute of Health and Welfare through providing access to our data assets, utilising the health data warehouse so that they can actually release data to researchers and other agencies across government. And so we heard mention of some of the work that's been done in response to the Productivity Commission's inquiry into data access and use, and this is actually one of the ways that we're participating in that. Not just investing in our own assets for use within the health portfolio, but actually making sure that they're available and a part of those broader initiatives as well. So that's something that we're trialling at the moment, and we'll look to continue to extend that. And as Mark mentioned earlier, that's really built on what's been several years now, where the department has actually been working with others to build those collaborative working relationships. And it's really pleasing, I think, that we actually have a platform. Our warehouse actually supports those new ways of working, that collaboration and connecting up of data across organisations. So, what are some of the capabilities that we're providing? Obviously acquiring data, so looking to actually bring in more data more quickly and having that available on our systems. Organising the data, so typically this has been an area that required a lot of time and curation. More modern approaches actually enable us to do that more dynamically so that users of data can find the data they need, they can understand how it can be used and what it can be used with, and also data that it can be linked with. Analysing our data, so we've heard about some of the sophisticated and analytical techniques that are being used and are becoming increasingly available. It's a very important part of our strategy that we're actually working with the rest of the business to actually support those, especially as we move to greater adoption of things like machine learning and artificial intelligence, where we're really only starting to get a sense of that, but certainly the technology and some of the capabilities is making that possible now. And of course, delivering our data. So Mark mentioned some of the changes that have happened around governance to streamline that process. We need to be able to support that with the right capabilities and make sure that when we're actually organising, managing our data, that actually also includes how we're actually going to make it available and share it with others. For security, which is very important, we've also recognised that we need to be architecting at the outset for security. So we're actually building that into how we're actually working with data information at the moment. So this is a complicated slide, but an important one. So if you start at the bottom, it's representing our infrastructure based around what has been our enterprise data warehouse, but is actually evolving now to include some of the more agile environments, such as Hadoop for big data. Above that, we've actually got the data and information layer. And it's really important that those things are connected. The technology is wonderful, but we need to make sure that actually we are bringing in and managing, providing access for analysis to the data and information assets. And above that, that is actually being used to actually drive business value, to generate those policy insights, to help us design better programs, to deliver a better health system and better outcomes for all Australians. And then up the top is really reflecting where we think we will be not too far in the future. And so we talk a lot about data, we talk a lot about analytics, but we've also heard today about collaboration and knowledge and learning and sharing of that information. And so the infrastructure that we're looking to provide into the future needs to be done in partnership with all aspects of the business to make sure that we're actually supporting that need, right from the technology through to the data, through to the business applications, and ultimately help drive learning organisation and improved health outcomes. So we've got a booth outside. I think everyone's got a booth outside, but if you get the chance to drop by at lunchtime, please do so.